Hi everyone, I'm Sahani. I work in communications and health promotion at the WHO country office for Sri Lanka. And I'm just going to speak a little bit about Sri Lanka's experience with infodemic management during the COVID-19 pandemic. To start, I'll just tell you a little bit about the Sri Lankan context and set the stage to let you know the types of rumors we dealt with and misinformation that was prevalent and why certain rumors gained more traction. Most of the misinformation can be grouped into kind of two large areas. One of them is stigma and discrimination. Prior to the pandemic, there was a strong Chinese presence in the country. And so there were some underlying tensions. And the first individual to test positive for COVID-19 was an individual from China. So some rumors and misinformation around this spurred stigma and discrimination that had to be countered very early on. Similarly, some of the early clusters were linked to tourists from Western Europe, and some misinformation around that led to stigma and discrimination that needed to be countered. The Tri-Forces and police have been involved in the government, in the response, in line with the all-of government response, and they've supported the Ministry of Health and the government largely with contact tracing, and they were able to leverage their large workforce to quickly build quarantine centers and emergency hospitals, things of that nature. But due to the country's history with civil conflict and a civil war, there was some underlying and historic tensions that were felt in certain communities and had to be addressed early on by clarifying their role. Similarly, some of the early cases were linked to the Muslim community, and this was picked up in several surveys that individuals felt that the Muslim community was experiencing stigma and discrimination because of the prevalence of cases. This was combated early on and has since faded to a large extent. The other main driver of misinformation has to do with events and the context in Sri Lanka. So to begin with, there was an early and prolonged lockdown. In certain parts of the country, the lockdown and complete curfew actually lasted for nearly 2 months. So this led to COVID fatigue, as well as the belief that when lockdown was lifted, that we were no longer at risk and prevention measures were not needed. Similarly, the elections were due to be held in April during the height of kind of curfew and lockdown in the first initial parts of the COVID pandemic in Sri Lanka. And there were some court cases, and the government voluntarily postponed the elections at least twice. But when they were finally held, there were some rumors circulating that cases were being suppressed in order to hold the elections. And this was something we had to deal with. There have also, up until recently, been very few cases in Sri Lanka. We were fortunate enough to be able to control the pandemic in the early stages. And because of that, that combined with COVID fatigue and a somewhat reasonable belief that that we were no longer at risk. For example, there were 2 periods of at least 30 days when there were no cases reported in the community, no cases detected in the community. So that belief, along with kind of a drastic shift from curfew to more or less return to normal life. There were recommendations in place, but they weren't strictly enforced. So people were not necessarily adhering to prevention measures because of this misinformation and rumors that were out there. There's also a strong history and widespread use of traditional medicine in Sri Lanka. And this was particularly difficult to counter because one, many of these practices, from herbal teas to steam inhalation to treatment oils, do bring about symptomatic relief, so it's hard to counter in that sense. And also many of them are not particularly harmful, so we had to respond to those on a case-by-case basis. And similarly to a few cases, we have been fortunate enough to experience a low fatality rate in Sri Lanka thus far, which has spread a lot of rumors around the idea that Sri Lankans are somehow more less susceptible to the virus, or that we have stronger immune systems, perhaps due to the BCG vaccine is a common piece of information out there, or that we are experiencing a lesser strain of COVID-19. There's a lot of information and rumors surrounding our low fatality rate. So I'm just gonna, now that you can get a sense of the type of misinformation we've dealt with, I'm going to tell you a little bit about the actions we took and how we responded to the misinformation and the infodemic in Sri Lanka. So we conducted rumor monitoring. We did this largely through 4 different means. The Ministry of Health has a 24/7 hotline for COVID-19 information that they set up very early on. It's trilingual. There's 3 languages that are primarily spoken in Sri Lanka. And we used reports from this hotline to get information about rumors and misinformation, but also the public's concerns surrounding COVID-19 and the type of information that they were seeking. We also received reports from our regional office, the Southeast Asia Regional Office from WHO. We received 2 reports from them on a weekly basis, one tracking rumors and misinformation online on social media, and the other tracking key conversations online and social media. These offered great insight. There was a good analysis that accompanied the reports, and these were very helpful. There's a bit of a limitation with languages in that, but I believe it tracked 2 of the national languages. We also worked with the UN Resident Coordinator's Office. They were able to repurpose one of their teams early on in our response. That team traditionally monitored conversations online about peace building, but they were able to change it to monitor conversations on COVID-19. And they produced reports that were particularly helpful as they showed how content changed over time and the trends. And finally, we contracted an external media monitoring company for several months. And this was really helpful because not only, in addition to tracking online and social media, they were able to monitor print media, radio, and television. And we know through community feedback that television is the medium used by most individuals in Sri Lanka to access health information. And radio is very prevalent around vulnerable communities and traditionally hard to reach communities. So we use these 4 different areas to monitor rumors and gain information about stigma and about the different rumors circulating in the country. We also worked with partners to amplify our messages and to basically amplify our messages. So first we partnered with local fact-checking groups. We met with them very early on and created a strong 2-way working relationship. We set up WhatsApp groups. They would come to us to verify information or to counter any rumors that were circulating. And in turn, we sent them any information that we felt would be better counted from a fact-checking organization and not directly from the ministry or from WHO. We also worked with community influencers to help amplify our messages and to gain buy-in in communities. So we worked with actors, religious leaders, singers, comedians, athletes, all sorts of individuals who really came together to support this cause, to build solidarity, and ask people to follow validated sources of information. We also tried to use innovation and different tools to increase our engagement. We set up a a chatbot on our Facebook group, on our Facebook page, as well as our website, and it was also featured on some other UN agency websites. This chatbot provided automatic information trilingually on certain topics, and it also was a place for us to gather information and to respond to specific rumors. And we launched a Viber community that has been growing, and it's a great way for us to hear from the community and to amplify our messages and to disseminate information to a wider audience. We also started creating myth-busting posts. We had two main types. One which spoke about information that specifically mentioned WHO and used our name as in the rumor. And then also we created these fact posts to counter common misinformation and rumors. I'm going to tell you a little bit about what seemed to work and some of our successes and what we think are best practices. So to leverage existing networks was really helpful for us. When the pandemic first started, we were in a bit of a transition area and we didn't have too many resources locally. So we were able to work with partners and volunteers who used their expertise to support our work. We also conducted monitoring in all three local languages, which we felt made sure that we didn't miss any misinformation that was community specific. We also referenced experts and guidelines. So we referred to WHO guidelines to make sure that the way we were countering information was science-based and evidence-based. That was very helpful. We also tried to learn from others as much as possible. We really appreciated the EpiWin webinars that were held, and learning from other countries and how they've dealt with the infodemic was really helpful, and we could localize some of those responses. And we also connected with the media really early on. We set up, again, WhatsApp groups to quickly disseminate information. We also proactively disseminated media updates regularly. The Ministry of Health has been conducting press briefings very regularly from the start. And we have joint press releases for major updates. And I think that relationship has been really helpful, and it's allowed us to amplify key messages in a broad audience. We also did not respond to posts individually. Instead, we counted rumors and misinformation on our platforms, which helped us keep some control over how we posted and to make it a little bit more systematic. It also drove people to our page, which had more information and resources for individuals to refer to. As mentioned earlier, we did fact posts. So we didn't necessarily say fake news or anything like that, but we said fact as to counter the information. We felt this was more positive, and it also kind of showed what was true from the start to reduce confusion. We also tried to offer alternatives whenever possible. So for example, we said that one of the posts we said, drinking warm water there's no evidence that drinking warm water will prevent COVID-19. However, physical distancing, hand hygiene, etc., are evidence-based prevention measures. The idea behind this was to kind of honor the enthusiasm of individuals who are interested and engaged in preventing COVID-19 and offering evidence-based solutions. We also dated our posts. This is a rapidly evolving situation, and we wanted to try to maintain a little bit more credibility in case one of the facts we posted out turned out to be false. At least there was a date on it, and so everything we said was based on evidence, the best evidence at the time. Finally, something that I thought was really helpful was getting information on rumors from multiple sources. So as I mentioned, we had 4 main sources, and this allowed us to cross-check information to make sure that the rumors were consistent, and it allowed us to kind of see the scope of a rumor or the misinformation, which helped us determine if we should respond. It also made us feel more secure that we weren't missing things and things weren't slipping through the cracks, and that we were doing what we could to respond to the information out there. While we did our best, we certainly encountered many, many challenges. So I'll just speak a little bit about some of the lessons learned and what we still need to work on. For one, I think we need to plan ahead a little bit more. In a crisis, it's kind of difficult, but if something we can get a handle on, I think it would be extremely helpful. So I think we needed to do an assessment early on and to determine our needs and act quickly. So like I mentioned, we leveraged existing networks and didn't necessarily take into consideration how quickly that support can go away. These people were volunteering their time, and eventually they had to go back to their own full-time jobs, and which was okay. But then we ended up having a gap in resources at a critical time when there was an unexpected spike in cases. And I think if we had planned ahead and been a little bit more proactive with that, we could have avoided that. It also would have been helpful to identify key stakeholders and a spokesperson early on. Like I said, the ministry, and we were speaking very regularly with the media, but if we had identified somebody, ideally with a medical background and media training early on, they could have become a trusted source of information, and somebody that people would be able to recognize as a source of validated information. I also think it would have been great, and we're still hoping to establish a dedicated campaign to fighting misinformation. We had the posts that followed a theme, like in a form, visibly a layout, so that they were associated with each other. But we kind of responded ad hoc when something was happening, and when we felt there was an urgent need. And I think if we had established, or if we do establish more weekly myth-busting sessions, that could be more effective, and it could also help us organize a little bit more. It also would have been really helpful to plan the monitoring reports and how we would use them a little bit better earlier on. So the external media company in particular provided excellent comprehensive reports. However, there was sometimes too much information in them for us to effectively use them. So it would have been helpful to be clearer in the terms of reference with the company that we need a summary on action points, on the most commonly trending information, and so that we could easily look at those reports and read the more in-depth analysis when we wanted more information. But otherwise, it was sometimes too overwhelming, and we weren't able to act on them. Similarly, I think this is difficult as the misinformation is varied, but if we could develop some criterion to on when and how and if we should respond to misinformation, that would have been helpful. Often internal debates kind of delayed our response, making us less effective, certainly, and at times even irrelevant. And sometimes we weren't able to produce the post because the rumor had died by the time we decided to counter it. It also would have been great to involve communities a little bit more. This was something that the lockdown and the nature of COVID-19 has made a bit difficult. The way that we traditionally work with communities has been more difficult to access. However, getting more two-way feedback at the community level and more in-depth conversations rather than just questions or surveys would allow us to tailor our response a little bit more and tell us how we should be responding to these rumors, not just which misinformation to respond to. Thank you so much for listening. I really appreciate you taking the time. And as our country director likes to say, stay positive and test negative. Take care.